Welcome back, everyone, to the deep dive. You know, uh, Today we're gonna jump into something kind of unique, something a little different. We're looking at medical case studies.
Oh, cool.
Yeah, and these are shared by Dr. Kishore Mittal, and it's actually really a tribute to an amazing doctor, Dr. R.S. Mehta, on his 100th birthday.
Wow.
So these aren't, your typical medical mysteries, kind of like those shocking diagnosis shows or whatever,
Right, right.
but they really showcase the power of observation and intuition. That clinical intuition when doctors face these difficult diagnostic puzzles.
Yeah, no, I love that. It's like, you think about all the technology and advancements in medicine, but you still can't replace that good old-fashioned, like you said, intuition, that gut feeling that some doctors out.
Exactly. And these are really like snapshots of diagnostic brilliance in action.
Yeah.
Um, we have excerpts detailing 5 specific cases where Dr. Mehta's expertise really shined, and
Mm.
especially in situations where maybe other hospitals or even, advanced technology had really come up short.
Wow, so he's like the doctor's doctor. Like when they don't know where to turn, they go to him.
That's a great way to put it.
Yeah.
Yeah, so our mission on this deep dive today is to really understand what made Dr. Mehta's approach so effective. Like, how did he see things that others missed? What can we learn from his methods?
Right.
And ultimately, we want to kind of see how this led to, breakthroughs and recoveries for patients who had often been through really long and frustrating medical journeys.
I'm fascinated already. Let's get into it.
Okay, great. So let's jump right in with our first case. This is one that Dr. Middle calls the unseen affliction.
Okay. The unseen affliction. All
All right.
right.
So this one's really interesting. We're talking about a 60-year-old man who had been dealing with a low-grade fever for a whole year.
A whole year.
A whole year. Can you imagine?
It's a long time to be feeling under the weather.
Yeah. And it wasn't just like he was, toughing it out at home. He went to major hospitals. He was seen in Bhopal. He went to Bombay Hospital in Mumbai, even Ames in Delhi.
Wow, so he saw the best of the best.
Absolutely. The best of the best.
And still no answers.
And still no answers. The only real sign they could find was that his liver was just slightly enlarged, barely palpable.
Hmm.
And to make things even more puzzling, a really well-respected sonologist did an ultrasound, and it showed absolutely nothing abnormal.
That's so strange. A year of fever and all these tests, and they're coming up empty.
I know it's kind of mind-boggling, right?
And hey,
It really makes you think how, even with all our technology, sometimes things can still be really elusive.
you would think something would show up.
You'd think so, right?
Hmm.
But this is where Dr. Mehta comes in.
Oh, okay.
Despite all these normal reports, something in his gut told him there was something more going on with this liver. So he went ahead and did a liver biopsy.
A biopsy. So even though the ultrasound was clear, he felt strongly enough to do something more invasive?
Exactly. He wasn't willing to just accept the negative findings, and that turned out to be the key.
So what did the biopsy reveal? What was hiding in there?
It turned out to be liver tuberculoma. Tuberculoma. It's basically a localized form of tuberculosis that affects the liver.
Oh, wow. So TB can affect the liver, too. I always think of it as a lung thing.
You're right. TB is most commonly associated with the lungs, but it can actually affect other organs too, including the liver.
Interesting.
And once they knew what they were dealing with, the patient was put on antitubercular medication and made a full recovery.
That's incredible. So the takeaway here is even the most sophisticated imaging can miss things, right? It's like you need that combination of technology and human expertise.
Yeah, and that sometimes a doctor's gut feeling based on experience and careful observation can be the most important tool of all.
I love that. All right. So case number 1, unseen affliction, TB hiding out in the liver. What's next?
Okay, so case number 2 is called a cardiological puzzle. This one involves a patient who developed a fever after having PTCA, an angioplasty, in Delhi.
Oh, so a heart procedure.
Yeah, and they were hospitalized for days, but doctors couldn't figure out what was causing the fever. So the patient was eventually transferred to Indore to be seen by a cardiologist who then called in Dr. Mehta for a consultation.
Got it. So another case where they've hit a wall and need his expertise.
Exactly. And here's the interesting part. According to Dr. Mittal, Dr. Mehta made his diagnosis just by examining the patient.
Really? No fancy tests or anything, just good old-fashioned observation.
That's what it seems like.
Mm.
It's pretty amazing when you think about it. This patient had just had a heart procedure, and no one could figure out why they were still sick. But Dr. Mehta, just by using his clinical skills, was able to crack the case.
Okay, so tell me, what did he diagnose? What was causing this mysterious fever?
He diagnosed it as Dressler's syndrome.
Dressler syndrome.
Yeah, it's actually a pretty rare inflammatory response that can happen after someone has a heart attack or even a procedure like an angioplasty.
So the body's basically overreacting to the heart event.
Yeah, you could think of it that way. It's like an inflammatory process that gets triggered after something happens to the heart.
And that causes the fever.
Exactly. It can also cause chest pain and other symptoms.
Wow. So something seemingly simple, like a fever, can actually be a sign of something quite complex going on.
Yeah, and it just goes to show that even after someone's had a sophisticated procedure like an angioplasty, a doctor's basic skills, listening, observing, putting the pieces together are still absolutely vital.
Absolutely. It's like back to basics, right?
Mhm.
Sometimes the answer isn't in a high-tech stand, but in just carefully looking at the whole picture.
I think that's a great takeaway from this case.
All right, I'm ready for case number 3.
Okay, this one's called the silent culprit.
Ooh, that's a good one.
So this case is about a patient who was brought in unconscious and had been unresponsive for 4 or 5 days. And like in our first case, the initial tests, blood work, brain MRI, all came back normal.
Oh, wow. So another medical mystery.
Yeah. But this time, there was a crucial piece of information in the patient's history. This patient had a history of brain tumor surgery
No.
and was taking 4 or 5 different anti-seizure medications.
That's a lot of medication.
Yeah, it is, yeah. And 2 of those medications were newer drugs that didn't have readily available drug-level tests.
Meaning they couldn't easily check if there was too much of the drug in his system.
Exactly.
Hmm.
So Dr. Mehta, he really focused on this part of the patient's story, the previous surgery and all those medications. He started thinking maybe this could be drug toxicity.
Ah, so maybe the new meds were building up in his system and causing the problems, but
Exactly.
they couldn't test for it to confirm.
Right. So instead of ordering more tests, Dr. Mehta decided to try something else. He carefully stopped the newer medications one by one, closely monitoring the patient.
So like a process of elimination.
Yeah, and it worked. The patient regained consciousness.
Wow, that's amazing.
It really is. And it's described by Dr. Mittal as a triumph of clinical judgment over blind reliance on investigations.
That's such a powerful statement. So the lesson here is don't underestimate the power of a thorough patient history.
Exactly. It's about understanding the whole person, their past medical events, the medications they're on, all of it. Sometimes the answers are hidden in plain sight within the patient's story.
It makes you think how many times maybe a simple piece of information gets overlooked because everyone's so focused on the latest tests.
That's a really good point.
Okay, I'm ready for the next one.
Okay, case number 4. This one's called a hidden cause of seizures.
All right. A hidden cause of seizures.
So in this case, we have a patient who had been experiencing frequent seizures and had been in and out of hospitals, but they weren't finding any relief.
Oh, that sounds awful. Seizures are scary enough, but to not know why they're happening.
Yeah, it's a really tough situation.
So how did Dr. Mehta approach this one?
Well, the breakthrough came from a very simple test, actually, a blood sugar test.
A blood sugar test.
Really?
For seizures?
I know, it seems kind of basic, right?
Yeah.
But it turned out to be crucial because it revealed that the patient was experiencing hypoglycemia.
Hypoglycemia, so low blood sugar.
Exactly. And that immediately provided a possible explanation for the seizures.
Because the brain needs glucose to function properly, right? So if your blood sugar gets too low, it can trigger seizures.
Exactly. But then, of course, the next question is, why was this patient's blood sugar so low? That's what Dr. Mehta needed to figure out.
Makes sense.
So they did more investigations and eventually discovered the patient had insulinoma.
Insulinoma, I'm not familiar with that one.
Yeah, it's actually a pretty rare pancreatic.
So again, another case where a seemingly simple test led to a big breakthrough. It's like sometimes we get so caught up in looking for complicated answers that we forget to check the basics.
You're absolutely right. And I think this case really highlights the importance of considering a wide range of possibilities, even the simple ones, when trying to solve a diagnostic puzzle.
Don't overlook the basics.
Exactly.
All right, what's our final case for today?
Okay, this last one is quite intriguing. It's called the vanishing lung lesion.
Yeah, vanishing lung lesion. That sounds kind of spooky.
It does a little bit, right?
Yeah.
So this case involves the husband of a head nurse,
Yeah.
and he was brought in by his senior surgeon, actually the former head of the Department of Surgery.
Okay, so we're talking high level here.
Very high level.
Yeah.
And the patient had developed some suspicious lesions in his right upper lung.
Uh-oh.
Yeah. And to make matters even more concerning, a very well-respected physician, the head of the Department of Medicine, suspected it could be cancer and recommended a CT scan of the chest.
So you have multiple top doctors worried about a potentially serious diagnosis.
Right, but here's where Dr. Mehta takes a totally different approach. Instead of ordering the CT scan right away, he asked a seemingly unrelated question. He asked the patient, "Are you from the family of a chief minister?"
Wait, what? What does that have to do with anything?
I know it seems totally out of left field, right?
Yeah.
But Dr. Mittal describes this as Dr. Mehta's signature wit. And I think it hints at his incredibly sharp clinical mind. He was probably trying to get at something about the patient's background or social context that might give him clue.
So like maybe something about their lifestyle or environment that could be relevant.
Exactly. And then what he did next was even more surprising. Instead of ordering the CT scan, he simply told the patient to take Bactrim DS for 1 week and come back.
Bactrim DS, that's an antibiotic, right?
You got it. So it seems like Dr. Mehta, based on his intuition and maybe the answer to that strange question, suspected an infection, not cancer.
Wow. So he went against the recommendations of other senior doctors and went with his gut feeling.
It seems that way.
So did it work?
Well, 1 week later, the lung lesions had completely disappeared.
Wow, that's incredible.
It really is. And it just shows you infections can sometimes mimic really serious conditions.
And that sometimes a simple treatment can be all it takes.
Absolutely.
So looking back at all these cases, what's the big takeaway? What can we learn from Dr. Mehta's approach to medicine?
I think the biggest takeaway is the importance of clinical skills, the art of observation, careful listening, and really trusting your intuition, especially when things don't add up.
Yeah, and not just relying on tests alone, right? It's about combining the technology with that human element.
Absolutely. And it makes you wonder, in the future, how can we better integrate all this incredible technology we have with that irreplaceable human element of clinical intuition?
That's a really good question, something to think about.
Yeah. And I think Dr. Mehta's legacy, as we've seen in these cases, provides a timeless reminder of just how powerful that human element can be. And on that note, I think it's time for us to wrap up today's deep dive. Thank you all for joining us as we explored these fascinating cases.